Welcome to Chapter 19. In this chapter, our discussion will be on caring for mother and infants. Mother and newborn usually have short hospital stays. At this point, let us understand some important information. In Canadian hospitals, healthy mother and healthy infants are kept in the hospital for 48 hours, and then they are usually hospitalized. Sometimes they might be in the hospital for longer days, depending on the complication and other issues, both of the mother and the infant. After the discharge from the hospital, the mother and infant go to the home. And our job as a support worker might be in the hospital before the discharge or in the home care setting after they are discharged. And the most common reason for home care after discharge include that the mother may have complication before or after childbirth. Before the childbirth, she might be having different experiences, complication of the childbirth, taking medication, visiting doctor's office so much times. After childbirth, she might have so much bleeding, she might have so much other C-section related complication. We say C-section or cesarean section when she cannot give birth to the natural way. Again, the mother needs help with other younger children in the home. Our duty may be preparing the younger children while sending them to school or receiving them from the school. Had a multiple birth, the more she gives birth, the weaker she becomes physically. That's why we have to focus on that and work. She might have a physical or mental health disability. She might have an infant with a special need. We need to focus on that special need kids. Some has intellectual disability. Some may have physical disability. We may have to support other kids, other siblings in the home as well. And difficulty adjusting to her new responsibility. Being a new mother has added so much new responsibilities. And new mothers or a mother recently giving birth has got so much new responsibility. There is a period called postpartum period. Postpartum means after the childbirth. The 6 weeks period after the childbirth. The postpartum period starts with the birth of the baby and it ends 6 weeks later. That is a very, very crucial part of her life, the mother's life and baby's life. Both are so much vulnerable. Mother undergoes so many changes at physical level and psychological level. At physical level, she might be very weak, taking so much medication and financial crisis, nutritional deficiencies, and all other things. So this is the main time to care the mother and the baby. The mother adjusts physically and emotionally to the childbirth. Psychologically or emotionally, mother has so much other problems like postpartum blues, which means a kind of depression which may remain for life or which may subside after the postpartum period. Caring for mothers continued. A vaginal discharge occurs at the childbirth. We as a support worker, we are working at this particular area very, very significantly. We are actually working with their blood. We have to change them. We have to change their briefs for the mother and diaper for the baby. And the vaginal discharge, it's called lochia. Lochia consists of blood and other matter left in the uterus. from the childbirth. Lochia rubra is a dark or bright red discharge. See, Lochia rubra. I just want you to know about this terminology carefully because these are very important for your exam as well as for your understanding as a worker. Lochia rubra is a dark and bright red discharge. Mainly blood, it is seen during the first 3 to 5 days. Lochia rubra is seen after 3 to 5 days of birth. Now the second comes Lochia serosa. Serosa means a kind of bodily fluid. It is pinkish brown drainage. It's not like the dark or bright red discharge like rubra. Rubra means red. And serosa is a pinkish brown drainage. It lasts until 10 days after the birth. This is a kind of vaginal discharge after until the 10 days of birth. 10 days of birth. Lochia alba is the third type of fluid vaginal discharge. It continues 2 to 6 weeks after the child is born. 2 to 6 weeks. So here you have to know all these points. On the one hand, Lochia rubra, red and dark and bright discharge. It lasts for 3 to 5 days. Lochia serosa is a pinkish brown drainage which goes up to 10 days after birth. And Lochia alba is a whitish drainage that continues 2 to 6 weeks after the birth. So the name of the fluid, the vaginal discharge, as well as the duration until which day they appear usually, you have to keep in mind. Normally, lochia smells like menstrual flow, the usual menstrual blood. Foul smelling means bad smell. Of lochia signals an infection. This is one of the cardinal sign of infection. Infection, when there is infection, what happens? Body temperature increase. The area becomes foul smelling. Heart rate increases. What happens? The pain increases, and so on. Perineal care. This is the area after a mother has given birth, our first work begins from perineal care. Let me remind you, what is the fundamental concept of cleaning the perineal area, front to back or back to front? Please do not get confused. Back side is anus, and do not bring the content near the anus area to the vaginal area. Never clean back to front. Always clean front to back. Good perineal care is very important. I asked you a question. Why? Because mother at this point is very, very vulnerable to get infection, urinary tract infection. That's why checking and changing. This is a formula. We nursing in the nursing field in this area, maternity section or the birth, newly born baby and the mother, we go with that. Just check and change. Sanitary pads are changed often. It depends on how much vaginal discharge is there. You may have to change every 4 hours or maybe every 2 hours, maybe after every half an hour you might have to change it. It depends on how much vaginal discharge is there. When wiping after elimination, the mother wipes from front to back. Please be mindful of that. The mother's wipes from front to back. This is the best way of cleaning the perineal area. Never back to front, because backside is the rectum, the anus. Because the feces from the anal area could enter to the vagina, that in a couple of hours it causes so much infection. And good hand washing is essential everywhere. good hand washing, hand washing, hand washing, hand washing. We support worker have to do three things basically: hand washing, hand washing, hand washing. This is very important and the most important work in our area. So hand washing is essential after perineal care. Even before perineal care, you have to wash the hand, use the glove, and touch the person. After changing the sanitary napkins, sanitary towels, and after elimination, both type of elimination. One is bladder elimination, which is urination. Another is bowel elimination, which is using the bathroom for bowel movement. Some mothers have episiotomies. This is a very, very important word, episiotomies. The doctor performs this procedure during the childbirth. Let's focus on episiotomies. What is episiotomies? The doctor performs this procedure during the childbirth to increase the size of vaginal opening for the baby to come out. The doctor may order sitz bath, SITZBATH, sitz bath, for the comfort and hygiene. So, to let the baby come easily in the natural way of birth, the doctor cuts the vaginal opening to make it bigger. That's called episiotomies. While cutting, there are injuries, the tissues are injured, there is a wound. And to help heal the wound, there is a sitz bath. The sitz bath is putting the perineal area on the hot, warm water for some time. It minimizes the pain and it increases the comfort for the mother. Now we are focusing on complication. What complication can be there? These include infection and wound separation, dehiscence. After the episiotomies, there is a wound. That wound is in a very, very critical place. That wound is in between the rectum and vaginal area. It's not the front side. It's the between the rectal and vaginal area. That's why when the mother has a bowel movement, the feces can come to this episiotomies area. These openings, the new openings. And until the wound is completely healed, our job is to clean the area very nicely and to prevent the bowel movement coming to the vaginal area, episiotomies area, the area which the doctor has done a kind of surgical wound. Those area we have to protect the feces to come to that area. And what happens if the feces comes and mix the area in the vaginal area? Feces is full of bacteria, and because of the bacteria there will be infection. That's why these include infection and wound separation, which is called dehiscence. Let's pronounce the word together. Dehiscence. It's called wound separation. There is the doctor has put the stitch in the wound, but the wound was not healed because of infection. The pus formation takes place in the wound, and the wound does not heal, rather it is separated, and it is called dehiscence. Tell the nurse once if the mother is complaining of the pain, discomfort, discharge. These are maybe the complication of infection, pain. If the mother has pain, if the mother is feeling discomfort, and if there is a discharge, like coffee color discharge, it is the sign of infection. Care for abdominal incision. Now we are coming to the cesarean section or C-section type of care to the mother who has not given birth in a natural way, or the mother has not given birth in a vaginal route. Some mothers deliver by cesarean section or C-section. The baby is delivered through the incision into the abdominal wall. Let's see the word cesarean section. This is a very common word in this area. You have to know it. You have to know with the spelling cesarean section, because when you have to document, you have to write it, and the abbreviation for that is C-section, C-section or cesarean section. Do not get confused of this. It's the same word. The baby is delivered through the incision in the abdominal wall. It's not through the vaginal, it's from the abdominal wall. A C-section is done when? What are the root cause of C-section? What are the need of C-section? It is the doctors who decide whether it is necessary for the C-section or not. Maybe because of the movement of the baby has to move in the clockwise. If the baby goes anti-clockwise, if the position of the baby in the mother's womb is totally unusual, then the need is realized and the C-section is performed by the surgical doctors. The baby must be delivered to save the baby's and mother's life. See, this is the most important element. The team of the doctor, they decide the baby must be delivered to save the baby's and mother's life. The baby is too large to pass through the birth canal, means vaginal area. When the baby is too large, it's not possible to come through the natural way. That's why C-section is needed. The mother has a vaginal infection that could be transmitted to the baby. See, mother has already been experiencing certain vaginal infection. What do you mean by vaginal infection? Urinary tract infection. That infection goes to the vagina. Maybe sometimes sexually transmitted disease might have caused some infection at this point. That's why the team of the doctors determined that C-section is the need. A normal vaginal delivery will be difficult for the baby or the mother in certain situations. The mother's doctor recommends a repeat C-section. The mother's doctor recommends a repeat C-section. These are the team of the doctor who recommend. Now, after the child is born, we support workers have very important role to protect the mother and baby from our work. Still, the nurses, the RNs, and midwives, the doctors, they are working there together. But again, we have very significant role to play because we are touching the client, the mother and the baby and giving them care. Now it is the time to feed the baby, and baby is fed from the breast care. Lactation is the process of producing and secreting milk of the breast from the breast. Now you have to go to the breast care. It usually begins around the third day after childbirth. Do you think the mother can feed right away after the child is born? Yes. In certain cases, in certain situations, this can happen. It usually begins, but in other cases, it usually begins around third day after childbirth. Till that period, mother is not giving the breast milk. The baby is being given the formula milk. Occasionally, the mother's breast may become engorged with milk. Engorged means the milk is, there is a retention of the mother's milk in the breast, and the breast become very swollen and full of pain, very hard, and there needs a kind of massage. Special nurses for this area will do those massage to and give the medication and decrease the pain and allow the mother to feed baby her breast. Now, plugged milk duct. Sometimes a mother can feel a tender lump. Tender means painful. Here, the word tender has a different meaning. Tender here means a painful lump in the breast. When the milk is not drained properly through the duct, it builds up within the breast. Yeah, it is the retention of the blood of the milk in the breast itself, and it builds up within the breast. An untreated plugged duct can cause a breast infection, which is called mastitis. When there is a itis word or titis word, it is infection. An untreated plugged duct can cause a breast infection, which is called mastitis. Breastfeeding continues with frequent feedings, including from the affected breast. Similarly, we talk about the mastitis, infection of the breast. Mastitis is an infection of the breast, can occur when bacteria enter a milk duct through the cracked nipple. And mastitis is usually very painful. When there is an infection, all infections are painful, and all infection causes increased temperature. These are, and all bacterial infection needs antibiotics. And this is a point when mother takes antibiotics, the baby is also getting the antibiotics. So this situation, mother is not supposed to take antibiotics because it transmits through the milk to the baby, and baby doesn't need the antibiotic. Baby doesn't have that immunity to tackle with those antibiotics. Therefore, our duty is to protect any kind of infection, urinary tract infection, or breast infection, which we call mastitis, of the new mother, to prevent the new mother's health and the baby's health. Early treatment is essential. Breastfeeding during the mastitis treatment is usually encouraged. Breastfeeding during the mastitis treatment is usually encouraged. The reason for that is when the mastitis treatment is there and the breastfeeding is encouraged, the breast has a chance to flow through the duct, and the more breastfeeding takes place, the more comfortable mother feels. That's why for the mother's comfort as well as baby's food, breastfeeding is highly recommended. The mother has an emotional reaction after the childbirth. Earlier slides we discussed about that. The mother has emotional reaction after the childbirth. Let's see what emotional reactions she might have. That, that causes include lack of sleep, more responsibilities of looking after the baby and other siblings, maybe, new roles as a mother, isolation, disappointment. Why disappointment? It's the mother's freedom is impaired by the childbirth because she has more time to focus with the child. Anxiety, this is a little bit psychological. Poor body image, mother sometimes expresses that her well-maintained body and its shape has been changed with the birth of a new baby. That's why she might have anxiety of the poor body image. Lack of support. If a mother does not have any support mechanism, support system, enough family member with the financial and other support, again, this causes anxiety. Hormonal changes. So many hormonal changes at this point of period. That's why mother goes so many type of anxiety, emotional reaction, emotional distress. And now we're talking about postpartum blues. Feeling of sadness or mild depression during the first 2 weeks after the childbirth. This is called postpartum blues. Remember, this looks a beautiful word, postpartum blues. Please remember this. This is a feeling of sadness and mild depression. Postpartum blues means a kind of depression mother has because of so many anxieties. Anxieties of isolation, sometimes lack of sleep. The baby is crying there. She has to give her more time to the baby. She cannot sleep and she has more role to play as a mother. She is in the different room in the isolation type of situation, and her body has changed a lot. And if she has a support could be okay, but lack of support even causes. So basically all these are the major points that contribute to postpartum blues for the mother. Postpartum depression. 10 to 15% Canadian women suffer postpartum depression after childbirth. Remember the number, 10 to 15% Canadian. Usually what happens when she is a mother of her first baby, a lot of changes occur and she doesn't have previous experiences. That's why 10 to 15% first time Canadian women as a mother have more these experience. Once they are used to giving birth, they might give two, three, four, depending on their culture, their need, and their interest, or whatever their plan to of the shape of their family. They will give birth. It can develop anytime during the first year after the childbirth. Depression. Postpartum depression during the first year after the childbirth. This is very significant time. A mother needs a lot of support at this time. She might be going to the mental health type of area because of the depression. So, this is our prime duty to communicate very nicely with the mother, and our role is just to be a bridge between the mother and infant and the nurses and the hospital. Sometimes we have to work with those situations as well. Usually it begins 2 weeks to 6 months after the childbirth. Professional care is needed as it can worsen over the period of time. This is what I am telling you. It might lead to the permanent mental health issues of the mother that begins from the postpartum after the childbirth. That depression does not subside. Rather, it remains intact with the mother. Sign and symptom of postpartum depression. Now we are here to focus on what are the sign and symptom of postpartum depression. Crying, feeling of sadness, hopelessness, and guilt, difficulty sleeping, inability to cope with everyday problems, avoid visiting with others, feelings of anger towards the baby, fatigue, extreme anxiety, delusion, and hallucination. Remember these two words, very, very important two words: delusion, hallucination. Delusion is a fixed false belief. Delusion is a fixed false belief. And hallucination is another thinking in a bizarre way. Something bad is going on around there. That's called hallucination. Generally, the drug addict has those delusion and hallucinated type of experiences. And again, the mother may have those experiences as well. Thoughts of harming the baby or self. See, this is the beginning point of mental health disorder at this point. Take it very seriously. When a mother is there, sometime they might have a thought of harming the baby or self. These are very, very important. We have to be careful. And our prime duty here is not only giving them personal care, but also communicating with them, helping them through the communication, working as a connecting agent to the nurses, to the doctors, to the healthcare facilities, to the families, and not leaving any communication gap. So we PSW had to develop very, very effective communication to prevent the mother and the baby. Now we are going to care for the infant. Infant safety and security. This is very, very important for everybody. Safety and security of everybody. Babies cannot protect themselves physically and physiologically. Physically, they cannot fight with the external forces, and physiologically, their immune system has not developed yet. That's why the safety related to giving medication, safety related to feeding them, safety related to breathing, safety related to circulation, all things are related with the safety. Remember the word safety and security. Security, safety and security of the mother and baby, very, very significant. Remember, our role as a support worker is getting broader and broader. We have to focus on so many things nowadays. Babies cannot protect themselves. Babies cry to communicate. Babies cry. Baby doesn't have developed the linguistic capability at this point. So communication, the baby communicates by crying. So if a baby cries, you have to think maybe the baby needs some water, baby needs some food. You have to think about that. Don't get irritated if a baby cries. It is the one and only medium of communication of those babies. Therefore, when wet, if their diaper is wet, they cry. When they feel hungry, they cry. When they feel hot or cold or tired, they cry. When they are uncomfortable in the sleeping position, we may have to reposition them every hour, every 2 hours to prevent the skin breakdown or in pain. So many things could happen. So address the situation as you know, and if you do not know, call the nurse or let the nurse know. Call the supervisor. You have so many things there. You have to document. You have to document, and you have to observe, document, report. Observe the situation, document, work, report, and facilitate the mother and baby. Similarly, now we are here to know about how to hold, how to take the infant. Pay particular attention to hygiene measures. What is the hygiene? How you clean the baby, how you change the diaper of the baby, pull-ups of the baby, how you clean the perineal area, how you clean the hands and legs and all other area. Please pay the attention to these measures. Handle a baby with a gentle, smooth movement. Your gentle touch will be of great value. Avoid sudden or jerky movement as they can startle or upset the baby. Certain people sometimes they do not touch the baby in a smooth and gentle way. Every type of jerky type of movement must be avoided while working with the babies. Use both hands to lift a newborn. Always support the newborn's entire body, especially the neck and the backbone area, very, very fragile. Their bones are not strong. And give support to the neck and the backbone area. Especially these areas are very, very fragile, can be broken anytime. Always support the newborn's entire body, especially his or her head. Head means the backside, the neck bone. Don't let arms or legs dangle. Dangle means hanging. If the arms and legs are dangled or it is remaining hanging, so the bone might be broken or the muscle might be broken. So do not let the arms and legs dangle. Other consideration when caring for infant: swaddling the infant, comforting the crying infant, cradle cap, diaper rash. These are the major areas to focus. While caring the baby, you have to give comfort. If the baby is crying, do not leave the crying baby unattended. Go and address the situation. Try to take the baby with you, or let the mother knows the baby is crying, because crying is a big and only one communication the baby has now at this point of baby's life. Address the situation. Check and change. Give some water, sip a little bit water, or give the baby food, or the breast milk, or the formula. Cradle the cap. You have the cradle where you put the baby, and use the cradle, or make the cradle move if it is movable. Diaper rash. This is the skin problem of the babies. Usually frequent using of the diaper causes different rashes to the baby's area, and we have to focus on those area diaper rashes. Certain creams are there to protect the diaper rashes. Because of the diaper rashes, the area in the perineal area is full of the discoloration in the skin layer. That's why we have to focus on the diaper rash. Have you ever seen the diaper rash of your own baby? In case there are different type of diaper rash: simple diaper rash, rash at the skin level, am- ammonia rash, ammonia rash. Ammonia rash means when the baby has a pee, ammonia comes in the pee, and that causes effect in the skin level. It's called ammonia rash. Another type, thrush. Sign and symptom of potentially serious illness. So, sign and symptom of potential serious illness of the babies. Infants can become ill very quickly. Sign and symptom may be sudden, so be very alert to note them. Once they start crying, something they need, it is to be addressed as soon as possible. Your page number 331 gives the idea of possible serious illness of the infants. Let's go to the book. What is there in page number 331? So the first point the book says is yellowish color, jaundice. This is a jaundice. The jaundice is related with which organ of the body? Can anybody tell me? It is the liver. The baby's liver is not fully developed, and there may be certain problem in the liver. A yellowish color to the skin and whites, and in the eyes and skin color you can see in the mucosa in the mouth. These are the sign and symptom of jaundice. Redness or drainage around the cord stump, in the umbilical cord area, or in the circumcision. In certain culture, babies are circumcised. The topmost skin of the penis is cut there right after the birth. Because of the increased temperature, ask the nurse to take the blood temperature, or ask the mother to take the blood temperature. If your job description allows you to do it, you can do it. Screaming or crying for a long time. There may be bluish color or pale skin color because of the circulation problem. Maybe noisy, rapid difficulty or slow respiration, and coughing or sneezing all the time, maybe the cold or flu. reddened or irritated eyes. If you let the baby cry for a long period of time, all these, most of these symptoms you can see. It is very, very painful for the babies. Turning the head to the one side or putting a hand to one ear, it means sign of the ear infection. Therefore, regular feeding must be there with the baby. Baby might sometimes vomit, vomiting most of the feeding or vomiting between the feeding. What type of vomiting? After feeding, what position is good? Otherwise, you feed the baby, you put in the baby in the wrong position, in the prone position or in the supine position, the baby might be vomiting there. Frequent water, green or mucus or foul smelling stools. If the baby has a frequent stools, bowel movement, this is very serious because baby do not do bowel movement for 3, 4, even 5 days. It is not considered that chronic constipation. Babies, if they do the bowel movement 2, 3 times a day, it is a problem. So as a PSW, as a support worker, you have to focus on those serious changes. Helping mothers breastfeed. You can help mother to bring the baby near her and to support as she guides you. It doesn't mean that you are there, you just take the baby and give mother's breast. Before you even touch the baby or mother, ask the mother. Breastfeeding is feeding a baby milk from the mother's breast. The baby can feed at the mother's breast. The mother can pump milk from her breast. She might collect the milk in a different bottle, or she can give that milk later. But the mother has the guidelines of how to protect the breast milk and give the baby. Breastfed babies are fed on the demand. Once they start crying, they are connected with the breast. Nurses or PSW, we have to help the new mothers to learn breastfeed. Tell the nurse if the mother or baby is having problem in breastfeeding. Maybe certain complication might be there. Maybe the mother has an engrossed breast. The milk duct is not letting the flow of the milk, or the baby is put in a wrong position, or after feeding the baby is put in the prone or supine position that causes the vomit as well. Similarly, we are helping mother bottle feed. Formula comes in 3 forms: ready to feed, powdered, and concentrate. Ready to feed, you have to see how much to feed, you have to know the volume, how much to feed at one time. Or if it is a powdered, you have to mix the powder with following the guidelines, what type of water is recommended to mix with the powder. Or the concentrate, the highly concentrated formula may be mixed with a little bit more water or other solution. Bottles are prepared one at a time or in batches for the whole day. Bottles are prepared for one at a time. One time you feed the bottle, and for the second time you have to boil the bottle in a very hot water, and you have to prepare for the second time. It's not that you prepare one time meal and keep the bottle with the milk, with the formula, and give for the second time. It is very serious. It can cause infection because those formula, they are sweet and they are highly nutritious, which can be anytime the bacterial colonization can occur in the formula very, very within short period of time. Use bottle stored in the refrigerator within 24 hours. Use bottles stored in the refrigerator within 24 hours. See, refrigerator. You cannot put in the room temperature because the room temperature can allow the bacteria to colonize there. Protect the baby from infection. Wash formula containers before opening them. Baby bottle, caps, nipples, and other items must be as clean as possible, ideally sterilized before the use. What do you mean by sterilize? Making the stuff bacteria free. Generally, boiling the bottles, caps, and nipples in a very, very hot water in a special pot. It sterilizes the stuff, the bottles, or the thing the baby come into contact with. Caring for infants continued. Bottle feeding the infant. Bottle fed babies are fed on demand, and it is usually every 3 to 4 hours. Most babies do not like cold formula out of the refrigerator. To warm a bottle before the feeding, do one of the following. So how you make, do you give the cold formula out of the refrigerator? No, because most babies don't like the cold. And how you warm the formula? Warm it in a bowl of warm water. See, warm it in a bowl of warm water, and turn the bottle often. Hold the bottle under the warm running tap water. Just the outside of the bottle, you can give the running water. Do not let the water enter the bottle. It's just the outside of the bottle to make it uh, um, uh, like the room temperature, to bring it back to the room temperature. To test the temperature, sprinkle a few drops on the inside your wrist. You can feel what is the temperature there. If it is still cold, repeat the process. If it is not, you can start feeding. The formula should feel warm. This is the biggest formula of the formula. The formula of the formula is give the formula bottle feeding when it is warm. Burping the infant. After feeding, take the babies in a very nice position and tap the backside. The baby starts burping. The air in the stomach and intestine causes cramping and discomfort. So every burp, after the babies start burping, it is the sign that they have taken out the gases from the stomach, and this can lead to vomiting. If they start burping, if you tap on the backside a little bit more, they might be starting vomiting. Burping helps to get rid of the air. Most baby burp midway and after the feeding. Pat or rub the baby's back with circular motion. Do this 2 to 5 times after feeding. If the baby gives a nice burp, means the baby is fully satisfied on the one hand, and on the other hand, the baby has just got rid of the air of the intestine or stomach. Position the baby for burping in one of the following ways. Page number 336 gives the main idea of that. Over your shoulder. Over your shoulder. First, place a clean diaper or towel over your shoulder. Support the baby in a sitting position on your lap. Hold the towel or diaper in front of the baby. Remember to support the infant's head and neck for the first 3 months after birth. As I already told you, remember to support the infant's head and neck for the first 3 months after birth. Why? The reason behind that, supporting the neck and the backbone, is their backbone and the neck bone is not fully developed yet. It has not been fully mineralized and full of the calcium. It's not that strong like ours. That's why if it breaks, then the baby, it's a life threatening, and baby cannot be bring back to normal life. And the baby, there is a 99.99% chances of death of the babies if the backbone is broken or neck bone is broken. Position the baby on your lap with his or her stomach down. First place, First, place a clean diaper or towel on your lap where the baby head will be. Because your may be full of infection, to prevent those bacteria, put a clear towel or a clean diaper on the lap, and on the top of that clean towel, put the baby. Diapering means the way of changing the diaper. In breastfed babies, stool are yellow and consistency of scrambled egg. Imagine the scrambled egg after you boil the egg, or after you make the egg, you scramble the egg, the making into different pieces. This will be the consistency, and the color is yellow. In bottle fed babies, stools are yellow to brown. See the difference. Breastfed babies have only the yellow, and the consistency means the thickness is like the scrambled egg. But bottle-fed babies' stools are yellow to brown. It's not necessarily yellow, it might be brown, or a yellowish brown, or yellow or brown. Their stools are firmer. Firmer means the consistency will be even more thicker than the breastfed babies. Over time, an elimination means bowel movement pattern develops. Elimination means going for poo. Over a time, an elimination pattern develops. Stools are usually soft and unformed. If they have a formed stool, what is the sign of formed and very formed stool? It is a sign of constipation. Stools are usually soft and unformed. Hard formed stool signal constipation. Watery stool means diarrhea. If the baby has a diarrhea, it leads to life-threatening condition. Every diarrhea and watery stool must be addressed as soon as possible. Call the nurse and report the diarrhea. Diarrhea is very serious in infant, because every diarrhea, what happens in diarrhea or vomiting or bleeding, all the bodily fluids are lost. The loss of fluid makes them dehydrated. When the infants are dehydrated, it's a life-threatening condition. Even if we do not drink water for the whole day, we feel nauseated and we start fainting. That's why dehydration is very serious concern, and every diarrhea leads to dehydration. Tell the nurse at once if you suspect the constipation or diarrhea. This is your prime duty, to call the nurse and report the findings. Diapers are changed when wet or when stools are present. There is only one formula of the diaper: check and change. When you check, if you find wet, just change it. And if you find the stool wet, means maybe because of the urination, and when there is a stool are present, again it is wet because of the stool, you have to change. To care for both cloth diapers. Not necessarily all the newborn babies are given the diapers. There may be soft cotton, 100% cotton clothes, the piece of the cotton clothes used as a diaper, which is reusable. Rinse and soiled cloth diaper in the toilet. Store soiled diapers in the diaper pail. Wash them daily or every 2 days. Do not wash them with other laundry item. Keep them separately. What is the reason behind them not not cleaning them with other laundry? Because other adult cloth and other laundry item may transmit the bacteria there in the baby's clothes. Therefore, we are just protecting those from other laundry item for the safety of the baby. Use a baby's laundry detergent. Uh, because adult and regular detergent may be very strong, because baby's detergent must be mild and very soft detergent. because it can cause the skin rashes. Detergent related skin rashes are another common skin problem of the babies. Therefore, we have to use baby's laundry detergent. It is a special detergent, by the way. Put them through the wash cycle a second time without detergent. What does it mean and why we have to put them in the second cycle without detergent? To clean the detergent itself. Put them through the wash cycle a second time. Once you did finish the first cycle with detergent, now without detergent, again, clean them only with the warm water or hot water. Dry thoroughly and folded for reuse. So these cotton cloth diapers are dried and folded for the reuse. Disposable diapers are secure with the Velcro or tape strips. There is a kind of taping the diapers, you know that. So there, which is called Velcro or tape strips. You use the tape to strip it, to tie it. Fold soiled diapers very nicely to prevent any leakage of the content. So the soiled area is on inside. Discard the diaper in the garbage. Do not flush it down the toilet. Very, very important thing. Never ever flush anything in the toilet, because even the toilet flushable items do not flush the toilet, and you are causing another problem to the family. You are putting the diaper in the toilet. There is a there is a jam in the toilet. Again, we are adding more problem. Therefore, never put anything in the toilet except the pee or poo. Changing diapers often helps prevent diaper rash, because when you put the diaper for a longer period of time, the diaper itself causes friction, continuous friction with the skin layer, which is very, very soft skin layer of those babies. Because of the continuous friction with that, the skin color and the texture changes, and it causes the rashes. When changing the diaper, make sure the baby is clean and dry before applying the clean diaper. There may be certain diaper rashes cream. You might have to apply that after making it pat to dry. If a diaper rash develops, tell the nurse at once. If the nurse has given certain cream, or the doctor has given certain cream to put in the diaper rashes area, you can put it. Always check. Do not put anything until you know, until there is written in the care plan. Care of the umbilical cord. This is a very, very significant area of care. Umbilical cord connects the mother and the fetus, unborn baby. Before the baby was in the mother's womb, this umbilical cord, they connected them together inside the mother. So umbilical cord is the organ. I'm telling you one new information. Umbilical cord is the new organ. Both the mother and the baby, in collaboration, they develop that organ. It's not the mother who developed that 100%. From the mother side, it comes. From the baby side, it comes. It connects together, and it becomes the umbilical cord. And it needs to dry in room air, not using the dryer or whatever way. The umbilical cord connects the mother and the fetus unborn baby. Shortly after the delivery, the doctor clamps and cuts the cord. A cord stump is left on the baby. The stump is clipped there, a kind of clip is put there, and the stump dries up and falls out 7 to 10 days after the birth. And it dries with the room air. The cord provides a place for microbes to grow. The cord is, there is a wound when it is cut. It's an organ. When it is cut, there is a wound. It is unhealed wound, but it's a different type of wound. It heals slowly without any medication, and we have to keep it very, very clean. And when we put the diaper, When the put the diaper, there is a formula. Cord care is done at each diaper change, and do not hide the cord with the diaper. Cord care involves the following. Keep the stump clean and dry. Do not get the stump wet. Keep the diaper below the cord stump. Beautiful idea. Very, very important. Keep the diaper below the stump cord stump. Give a sponge bath until the cord stump falls off. Note that in some places it is now acceptable to tube bath a baby before the cord stump falls off. Always check with your employer or for the policy related to bathing. Always check with the nurse. If you are carrying the baby at home, you don't have the employer. That's why you have to double check with the nurse. Call the supervisor and ask the family member what is their tradition. In certain culture it is recommended, sometimes certain culture it is not recommended. Always double check with that every possible ways, because before you make any mistake it is always a better idea to ask and get confirm about that. Do not pull the cord stem off. Never pull it. It's not something we can pull. It's naturally it has to fall. Never pull it. Report the following to the nurse. Those are the unusual and abnormal finding. If you see those abnormal finding of uh, the cord, if it is swelling, if it has changed in the color and it has become red, if it has a foul smell, odor, drainage from the stump, maybe some pus, some blood, whatever, bleeding from the cord or navel area, and fever. These all are basically infection. Because of the infection, these are the cardinal sign of infection, it is called in nursing. So you have the same knowledge. These are the cardinal sign of infection. These are the is a classical sign or whatever you say, cardinal sign or classical sign of infection. That's why if we find these abnormalities, our prime duty is to observe it and to report it to the nurse, to the nursing supervisor or the nurse as soon as possible. Caring for circumcised or uncircumcised baby. The surgical removal, do you know what is circumcision or not circumcised? Circumcised is a surgical procedure after the baby is born. The surgical removal of the foreskin of the penis is called circumcision. It's a surgical removal. In certain culture, it has to be done. So it is not our choice whether you are caring the circumcised or uncircumcised children. It is their own choice. It is their cultural speciality. They do it or do not do it. It is their duty. Our duty is we have to care. So if a circumcised baby is there, then the procedure is promote the good hygiene, because when circumcised there is a surgical removal of the skin, foreskin of the penis, the tip of the penis. That's why we have to promote the good hygiene, lower the risk of certain cancers. So generally this procedure is thought to promote the good hygiene. We have to clean the area, and this procedure is done for the hope of good hygiene and lowering the risk of certain cancer for the baby in the adult life of the baby, decrease the risk of sexually transmitted infection because of the foreskin, the retraction of the foreskin. People with the uncircumcised penis, they are supposed to have more sexually transmitted infection. That's why they are circumcised. But it is something cultural. Circumcision is a religious ceremony in a Jewish faith. Not only Jewish faith, there are other cultures also it is done. Circumcision should not interfere with voiding. When people the foreskin of the penis is cut on the top of, and it should not interfere with voiding. the baby has to void, I mean the pee or urinate in a normal way. Care of infant with circumcision. Carefully observe for the sign of bleeding, odor, damage, or infection, because this penile area is very, very sensitive. There are nerve endings, there are uh, blood vessels, and so many things. Always care for the bleeding and odor. If it is foul smelling, it is a sign of infection. If it is an infection, it has increased temperature, it's warm to touch, just report the nurse. Check the diaper for bleeding. So how you check the bleeding has occurred or not? You can check the diaper, because diaper covers the penile area. Report any concern to the nurse at once. The area should heal in 10 to 14 days, 2 weeks. Circumcision care involves the following. These are, be mindful of the following things. Clean the penis at each diaper change. There may be sometime the fecal content might be contaminating the penis area, so always change the penis, clean the penis. Use mild soap and water, plain water or commercial wipes at the nurse's directions. So how it is cleaned? It is recommended in the care plan. Just follow the care plan. Apply a petroleum gauze dressing, because it is a surgical wound. The skin is surgically removed on the top of the penile area. That's why apply the petroleum gauze dressing. Use a cotton swab or apply petroleum jelly to the penis. Apply diaper loosely. Do not make the diaper tight, because tight diaper might cause pressure there and it cause pain. Caring infants. Bathing an infant. It's called bathing, and a bath is important for hygiene, good skin care, comfort and relax the babies, time to hold, touch and talk to the babies, stimulation. We can stimulate the baby. The baby gets so much excited while giving bath. It's a The good hygiene makes the good skin care makes the babies feel comfort. Babies are feeling comfort, or baby feels comfort. It's the time to touch. Sometimes mother is cleaning the baby, you have to support the mother. Sometimes mother is not able to clean the baby or do the work, you have to do the work. Always ask before doing anything. We have to ask, and we have to know what we are doing. Do not do anything if you do not know it. This is a formula for every nurses, every PSW. Do not do anything if you do not know it. Do not touch anything if you do not know it. Ask first. Have knowledge first. Have a rationale first. Know that why you are doing it, and then only start doing it. And always take the permission. It's their babies. We are just there to work for our shift. The baby doesn't belong to us. We have a good relation. We have a therapeutic relation with the baby. It doesn't mean that you are just holding the baby as you wish. No, it doesn't work like that. So we are just caring for the babies or infants. Planning for the bath is very, very important. You can leave the baby alone if you forget something. Can you leave the baby alone? Never ever. Do not do it. You cannot leave the baby alone if you forget something. There are two bath procedures for the baby. Sponge bath given until the baby is about 2 weeks old. It means the baby is not taken to the shower room, or like other general usual bath is not given. Sponge bath is baby is sleeping in the cradle in the bed near the mother. Either the mother gives that sponge bath, or under her supervision or nurse's supervision, or um, you can give bath to the baby. Tube baths are used after the cord site or circumcision site both have healed. So the umbilical cord, when the cord is uh, totally dry and the wound is healed, or the circumcision, the foreskin of the penis, if it is totally healed, then good to go for the tub bath. Some provinces allows all babies to be bathed in a shallow tube water. Always check your employer's policy related to bathing babies. Always check the policies. Nail care. Babies' fingernails and toenails are kept short because they are moving all the time, the nails and the hands and the legs, and their own nail of the hand and leg can scratch their own body. That's the great rationale behind making their fingernails and toenails short. Nails are best cut when the baby is sleeping. Use infant nail clippers and a soft emery board. After cutting the nail, there is a place in the nail clippers. It's called soft emery board, and you just use that. For fingernails, clip following the natural shape of the nail. Clip following the natural shape of the nail. You don't cut the nail in a different way. As the nail has grown, cut the nail as it is in to maintain the natural shape of the nails. For toenails, clip straight across as for an adult. For the toenails, we do not follow the natural way. We cut across like for an adult. Smooth rough or sharp edges with the soft emery board. Smooth the nail. Do not leave the nail very pointed or very sharp because they are all the time playing their hand on the face and the facial skin could be broken or could be scratched by their own nail. Weighing infants. Taking the weight. It's called weighing. Infant's birth weight is the baseline for the measuring growth. What is the normal weight of a baby? Do you know? The, the normal weight of the baby is considered 3 kg. 3 kg, and it depends on the mother size also sometime. Depends on so many things like nutrition the mother ate during the pregnancy and all other things. Infant's birth weight is the baseline for measuring growth. Protect the baby from chills and weighing. From chills while weighing. Chills means from the cold. Always keep a hand over the baby while weighing to protect the baby from falling. So baby can fall in at any time. They have no control over their body. So we have to control their body. That's why always protect the baby from falling. And thank you for your patience and listening to this class. And thank you. Have a good day.